Hello and welcome to EMR Optimization for Cancer Screening, PS Suite EMR. This video is part of training module number 4, and the topic is Using Reminders for Cancer Screening. Please take a moment to review our speaker disclosure slide. The objectives of this training video are to help PS Suite users understand the purpose of reminders and how they work, learn how to manage reminders, and understand how to use the reminder report. If you recall from training module 2, we talked about how searches are a tool for population-based screening in a typical cancer screening workflow. By contrast, reminders help us facilitate opportunistic screening. Let me explain. In this piece of the workflow, you start with patients getting screened. The results of the screening tests come into the practice and are entered into the EMR. This automatically resets the reminder, which will activate once again when it's time for the patients to be screened. Clinicians will see the reminder when they are with a patient and will use the reminder as a prompt to encourage screening. So there are two types of reminders that you need to know about: global reminders and individual reminders. Global reminders are set up in the system using specific criteria. Once set, the global reminder is automatically applied to all patients who meet the criteria. You will use global reminders to provide a quick and easy prompt to talk to patients about routine screening. Individual reminders are a bit different, as they are applied on a patient-by-patient basis. You will use individual reminders when a patient needs screening outside of the normal recall period. For example, when a patient needs a mammogram every year rather than every 2 years. So let's look at global reminders a little more closely. The reminders are created using the same criteria as your cancer screening searches. In fact, the criteria will look identical, telling the system where to look and what to look for in every patient's record. These criteria are then connected to a reminder action, the wording that will indicate to the clinician what the patient needs. In this example, we'll set up a reminder that will tell us to order a mammogram when the patient is due for breast screening. Once the reminder is saved, the system will automatically search through the charts of all patients and place the reminder action in the charts of the patients that meet the criteria. The reminder action will be visible in the reminder field of the patient's profile. But what happens to a reminder once it's in there? A key point to remember is that there are only two ways to get rid of a reminder from a patient's chart. The first way is if a patient's information changes so that they no longer meet the criteria of the reminder. This will happen if they get a screening test done and the results are correctly entered into the system. It will also happen if the patient reaches an age where they are no longer eligible for screening. The second way to remove a reminder is to delete the global reminder. But this will remove the reminder for all patients. The bottom line here is that unless one of those two things happen, the global reminder will stay in the patient's chart. But sometimes you may act on a reminder without the patient's information changing. Maybe you have talked to a patient about screening and they have refused, or maybe the patient has agreed to get screened and you are waiting for the test results to come back. In these cases, you can respond to the reminder so that there's a record of what has happened. To respond to a reminder, double-click on the reminder action in the reminder field. A window will open with options to update the reminder. Choose the update that you want and write in any additional text that will help you remember what happened. Clicking the first option, which is Continue Reminder, will remove a reminder response. When you have responded to a reminder, the reminder action will appear crossed out with the detail written in beside it. It's important to note that responding to a reminder is not the same as removing a reminder. The reminder will still be in the patient's chart until the patient gets screened. This point is also key because reminder responses do not go away on their own, even if a patient is screened. When the patient once again needs screening and the reminder comes back, the response will still be there with the reminder action crossed out. That's why it's important to always remove the reminder response if it is no longer relevant. To remove the response, open the Update Reminder window by double-clicking the reminder action. Choose the first option, Continue Reminder, and then click OK. The reminder response will return to normal. Reminders also allow you to use a very useful tool called the Reminder Report. This report will provide you with a list of every patient that has a reminder in their chart. You may be thinking that this sounds very similar to running a search, and you would be correct. The Reminder Report is another option for doing population-based screening in your practice. Reminder reports have one advantage over searches, however, and that is when you get your report, the information includes the reminder action and indicates which reminders have responses. This way, if you're getting a list of patients to call, you can save time by not calling patients who you know have gotten screened or who have refused the test. That takes us to the end of this training video. We have 2 additional training videos on the topic of reminders. The next video will show you a real demonstration of how to set up a global reminder. The last video in this module will show you a demonstration of how to run a reminder report. We also have short tip sheets on how to create sample reminders for breast, cervical, and colorectal cancer screening. Before you move on, please take a moment to complete the short quiz that will test what you've learned in this module. Thanks very much for watching.